Hello dear students, welcome to Vision Pharmacy. In our today's video, we are going to discuss some of the important MCQ based on Introduction to Biopharmaceutics. But before we begin with our video, please do like, share, subscribe and do not forget to press bell icon for getting recent notifications. So let's begin students. The first question is, what is the primary site for drug absorption in gastrointestinal tract? And the options for these questions are A. Stomach, B. Jejunum, option number C. Duodenum, or option number D. Colon. And your time starts now. Please stop. Time up. The correct answer for this question is jejunum. Okay, so it is a primary site for drug absorption in gastrointestinal tract. Moving to next question. The question is, which factor does not influence drug absorption? And the options are A. pH of gastrointestinal tract, option number B. Solubility, then the next option is particle size, and the last option is molecular weight. Your time starts now. Please stop. 10 seconds up. The correct answer for this question is answer molecular weight. Okay. So molecular weight generally has a minimal impact on drug absorption. Moving to the next question. The question is, what is bioavailability of intravenous, that is IV drug? And the options are first one 50%, second 80%, third 75%, or last 100%. Your time starts. Please stop. Time up. The correct answer for this question is 100%. So bioavailability of IV drug is considered 100% since it is administered directly into the bloodstream, right? Then moving to the next question. The question is, what is the purpose of dissolution test in biopharmaceutics? And the options are option 1, to assess drug metabolism, option 2, to measure drug release from its dosage form, option C, to study drug distribution, or option D, to determine the drug's stability. And your time starts now. Time up. The correct answer for this question is to measure drug release from its dosage form. Okay, so dissolution test evaluates the release of drug from its dosage form. Then moving to next question. The question is, what is the primary enzyme responsible for drug metabolism in the liver? And the options are A. lipase, option 2, amylase, option 3, cytochrome P450, or option D, protease. Your time begins now. Time up. The correct answer for this question is cytochrome P450. It is the enzyme that plays a major role in drug metabolism in the liver. Moving to next question. The question is, what is the primary route of drug excretion for water soluble drugs? And the options are A. liver, B. kidney, C. skin, and D. lungs. Your time starts now. Stop. Time up. The correct answer for this question is kidney. Okay. So water soluble drugs are primarily excreted through the kidney. Moving to next one. The question is, which pharmacokinetic parameter is calculated using the formula AUC upon T? And the options are A. Clearance, B. Bioavailability, option C. Volume of distribution, or option D. Half-life. Think for the answer. Your time begins. Stop. The correct answer for this question is bioavailability. So bioavailability is often calculated as a ratio of area under the curve, that is AUC, to time. Moving to next question. The question is, the pH partition hypothesis is associated with which drug absorption process? And the options for these questions are A. Active transport, B. Passive diffusion, C. Facilitated diffusion, or D. Pinocytosis. Your time begins now. Please stop. Time up. The correct answer for the question is passive diffusion. So pH partition hypothesis explains passive diffusion based on pH gradient across cell membrane. Moving to next question. The question is, what is primary goal of in vitro in vivo correlation, that is IV/IVC studies? And the options are A. To determine drug stability, option B. To assess drug metabolism, option C. To study drug interactions, and option number D. To predict in vivo drug behavior with in vitro data. And your time begins now. Time up. The correct answer for the question is to predict in vivo drug behavior with in vitro data. Okay, so IV/IVC studies aim to establish a relationship between in vitro drug release and in vivo drug performance. Getting? Moving to next question. The question is, what is the primary factor affecting drug absorption in the small intestine? And the options are, first pH, next surface area, next blood flow, and last enzyme activity. You can think for the answer. Your time begins now. Please stop. The correct answer for this question is surface area. So small intestine has large surface area for drug absorption. Getting? And this is the factor which influences absorption. Moving to the next question. The question is, which of the following is characteristics of passive diffusion in drug absorption? And the options are, first requires energy, option B moves against concentration gradient, option C follows concentration gradient, and D involves carrier proteins. So you can think for the correct answer. Time up. The correct answer for this question is follows concentration gradient, right? So passive diffusion is a passive process that occurs down the concentration gradient. Moving to the next question. The question is, what is the primary factor influencing drug absorption in stomach? and the options are pH, then surface area, blood flow and enzyme activity. So you can think for the correct answer. The next question is, what is the primary factor influencing drug absorption in the stomach? The options are pH, surface area, blood flow and enzyme activity. Your time starts now. Stop. The correct answer for the question is pH. The acidic pH of stomach can affect the solubility and absorption of certain drugs. Okay. Moving to next question. The question is, what is the primary mechanism of active transport in drug absorption? The options are diffusion through lipid membrane, then facilitated diffusion, carrier mediated transport or movement through aqueous channels. Your time starts now. Please stop. The correct answer for the question is carrier mediated transport. Okay. So active transport involves use of carrier protein to move drugs against concentration gradient. Okay. Moving to next question. The question is, which of the following is factor affecting drug excretion through the kidney? The options are age, then molecular weight, lipophilicity or protein binding. Your time starts now. Stop. The correct answer for this question is molecular weight. So molecular weight influences the filtration of drug in the kidney, right? So that is the responsible one. Moving to next one. The question is, what is the primary advantage of sustained release dosage form? And the options are short duration of action, rapid onset of action, high bioavailability or reduced side effect. Your time starts now. Stop. The correct answer for this question is reduced side effect. So sustained release dosage form can provide a controlled or more controlled and prolonged release of drug, reducing side effects. So that's all students in our today's video. Thank you for watching till end.